Hi everybody, this is a video about heavy metals and what we should do after the heavy metal levels seem to be normalized or down to an acceptable level. So as per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only, and if you need medical advice, please talk to your healthcare provider to get that advice. So a question that comes up all the time in my practice is, okay, we've got my heavy metal levels down to a good level or down to an acceptable level, so what do we do moving forward? And in terms of the type of testing I'm referring to something called provoked heavy metal testing. So where a patient collects a baseline breath sample, geez Louise, thinking too much about SIBO, a baseline urine sample, then they have a chelating agent administered, ideally intravenously with a combination of EDTA and DMPS, maybe orally using something called DMSA, and then they collect another urine sample afterwards, and then we compare the results and we see essentially how much metal is hiding out in the patient's tissues. So it's kind of like we're going fishing for heavy metals. I've talked about this in some other videos, so please feel free to cross-reference those for more information about the actual testing process itself. So if we see, for example, that the post-chelation level, the lead level is really high or mercury level is really high, then we do chelation therapy through either IV or oral agents and get the metals down until we see the levels getting down to an acceptable value. And once they're at an acceptable level, then the question is, well, what do we do moving forward? Do we just leave things be, like job's done, or do we need to do any additional testing, or what do we do moving forward? So what I typically recommend for my patients, and of course it depends on what their goals are there are other things going on, etc., finances, all that good stuff, but generally what my recommendation is for my patients for the most part is after we get the heavy metal levels down to a good looking level in terms of their post provocation level, like when they retest, then I usually recommend waiting, depending on the case and exposures and their age and this and that. Are they, for female patients, are they pre or postmenopausal, which is going to impact this to some extent, then I'll recommend retesting after maybe 3, 6, 9, 12 months and see how the levels are looking. And the reason that I recommend doing that is because chelation therapy is great at helping to haul out the metals. It's really, really effective in the vast majority of cases in my experience at doing that. However, it's not able to get all of the metals out of all of the tissues. Some tissues are harder for the chelating agents to access. In particular, it's hard for them to fully permeate into the bone tissue, which is the main reservoir for lead in the body. And then to my understanding, it's also challenging for those chelating agents to cross the blood-brain barrier to pull all the mercury out of the brain tissue and out of the nervous system tissue. And so for all intents and purposes, the results that we look at, or the results that we get after bringing the heavy metal levels down, are telling us the levels of metals in the soft tissues, like the muscles and the liver cells and fat cells, etc., those levels are lower, which is great, but it's really not telling us definitively what the levels are like in those harder to access tissues like the brain and bones and whatnot. So the only way we can really figure out that is over time, seeing, say we retest after maybe 6 months, and if we see, oh, your lead levels, had been way up here, now they're down here, and now we're seeing them kind of creeping back up, well, to me, that's an indication clinically that there must be lead, leaching back into the system. And this is, of course, assuming that the patient's not, being exposed to lead in their environment or whatnot. And there's ways we kind of screen for that. But the long and short of it is that by seeing how the levels look over time, after we just kind of let things marinate or let things rest, then we see, are the metal levels actually coming up over time? And if they are, it suggests, well, the metals are being released from some reservoir in the body. And so in my practice, what I typically recommend for my patients is that we do a little bit of heavy metal cleanup, then wait another 6, 9, 12 months, test again. If the levels start to creep up again, then we'll do another treatment and treatment course and kind of pulse like that. And then eventually we stop seeing the levels go up, and indeed over time we'll generally see them going down, depending on what kind of maintenance work we're doing with detox support, etc. So there's certainly nuances to the exact steps that we take with each individual patient, but that's kind of the general gist of it. So I hope that this information was useful. If anybody has any questions about this topic or anything else, please feel free to post in the comment section below. And if you yourself are listening to this and you've worked with chelation therapy or other treatments that help to address detox support or get rid of heavy metals or other toxins from the body, please feel free to post in the comment section below and just let us know how that went for you, what kind of things were helpful, what kind of things weren't helpful. I always find it to be useful and educating to see what has helped other folks, and I'm sure other people listening would be interested in that too. So thanks for your attention, and I'll leave it there for now.